Achalasia is a disease where it's actually a hypertrophy or it's a strengthening of the lower esophageal sphincter, that collar sling musculature that's between the esophagus and the stomach. It tends to become overly prominent and it doesn't relax. And when that happens, patients complain about a lot of dysphagia or food sticking. They feel like food goes down, but it really gets stuck right in this area, and sometimes they can have pain, sometimes they can actually regurgitate the food back up. Sometimes they say, I can't eat solid food anymore, I can only drink liquids. And what you see endoscopically is it's very difficult for you to get that scope. When we put the scope down the throat into the esophagus, it's very difficult to get that scope through the lower esophageal sphincter into the stomach sometimes. It's not an audible pop, but you feel it pop as you get into the stomach. And with some other testing, you can figure out, yeah, this patient truly has achalasia. The treatment for that is where we go in and we cut that muscle, either endoscopically, meaning down the scope with the throat. Again, that's called the POEM procedure, a per-oral endoscopic myotomy. Or you can do it laparoscopically with tiny incisions on the abdomen, where we go in and we cut that muscle, and then we also do a partial fundoplication to help with reflux, where we flip the stomach kind of over on top of itself to help with acid reflux disease. So there's some really good treatments, and most of the patients, after they get done with that, as long as the workup and diagnosis is made correctly, they feel fantastic. They can eat again, they can drink again. They've kind of got a lot of their quality of life back, which is really neat.